My name is Dr. Jason Poston. I went to medical school at the University of Washington in Seattle. I did a residency at the University of Kentucky, specializing in anesthesiology, and a fellowship at the University of Utah, specializing in pain medicine. My path to becoming a pain physician first started with treating patients who were suffering with severe pain syndromes as a resident at the University of Kentucky. I had some mentors who were able to do some remarkable things to treat patients who suffered, and as such, I became very interested in this specialty. I first implanted an intrathecal drug pump during my residency at the University of Kentucky about 12 years ago. So intrathecal pumps fit uniquely in our practice because we're able to take a patient who really suffers, who is on potentially high-dose opioid therapy, and deliver tiny doses of medicine to the desired site of effect that really is able to change their pain. It also is able to improve safety in today's environment with the opioid drug epidemic. We're able to take some of the management of a patient's daily pain away from them and transfer it really upon our shoulders. We're able to give tiny doses of medication that is much more effective in treating pain than, say, an oral pain medication that somebody may have to take every 3 to 4 hours to treat these very difficult pain patterns. And so we go to an intrathecal pain pump, and we use them probably earlier in our practice than even, I would say, 5 years ago. We're using them earlier and earlier in our pain treatment algorithm. In our treatment algorithm, we use them very early in certain types of pain. Patients who have cancer pain, we use them very quickly. We either do, say, a neurolytic procedure where we place alcohol on certain nerve targets and ablate nerves, or we go directly to targeted drug delivery with an intrathecal pain pump. These are very effective, and often patients come in with terrible adverse effects from very high-dose opioid pain medications. And so we're able to take them off their oral opioids, and they feel much better as we deliver medications to a targeted site. We've been using the Promitra 2 for approximately 1.5 years, and we had some problems with some competitive pumps. Namely, these pumps were not accurate. When we would deliver medications to the patient, we would see over-infusions or under-infusions, and essentially what we set as our targeted rate for the pump was not always what we were able to achieve. With the Promitra pump, we've been able to achieve very accurate targeted drug delivery to the spine, which is really important because when you're delivering tiny doses to the spine, you want to be as accurate as possible. There's also some other safety features of the pump that have been attractive to us. One being the pump has a pressurized reservoir, and in filling a pump, it requires some manual dexterity, and we fill the pump really by feel. That pressure allows us to know that the needle is actually in the desired location. There can be some problems if the pump is filled in a manner not according to manufacturer specifications, and the medicine actually goes into the patient and not into the pump. And there's some safety factors with this pump that allow us to feel more confident in our filling technique with the pump. So a recent patient was an elderly gentleman who had multiple back surgeries and had terrible, debilitating pain. He was on very high dose oral pain medications, and his pain was unsatisfactorily managed, and his activities of daily living were terrible. We were able to place an intrathecal pain pump and completely eliminate all of his oral pain medications and improve his functionality significantly. Pre-implant, a patient normally is thinking about their next dose of pain medication. They constantly are looking at the clock and wondering when they can take their next pain medication. Post-implant, a patient rarely thinks about their next dose of pain medicine. They're able to perform their activities of daily living, and they're thinking about life rather than their pain. Here at Pain and Spine Specialists of Idaho, we manage approximately 400 intrathecal pain pumps, and we place anywhere from 150 to 200 pumps every year.